Dr. Rashmi Gadgil embarked on her medical journey after graduating from Government Medical College, Nagpur in 2008. Her early experiences included attending the Sevanpur Youth Inspiration Camp, visiting several organizations and individuals working in tribal sectors, which instilled in her a deep sense of social responsibility and a motivation to serve in rural India. Despite having the opportunity to pursue specialized MD/MS, Dr. Raut Gadgil chose to complete a fellowship in family medicine at CMC Vellore from 2015 to 2017. This training equipped her to work effectively in resource-constrained settings with expertise in internal medicine, obstetrics, gynecology, pediatrics, emergency care, and preventive care. Dr. Raut Gadgil has served as a medical officer in government rural hospitals and played a significant role as a nodal officer at a Tehsil level COVID care center, where her work was recognized by the district administration. During the pandemic, she also voluntarily treated critical COVID patients and worked at a semi-government COVID care center, where she began to explore the integration of traditional medicine practices such as Ayurveda with modern medicine. Currently, Dr. Raut Gadgil operates her own clinic in Ajara, providing holistic treatment with a rational approach using various therapies. She's also writing a book in her native tongue, Marathi, on women's health and expanding her knowledge by studying Ayurveda rigorously under Vaidyaraj Dr. C.V. Desai. Welcome, Dr. Rashmi, to deliver your presentation. Please come.
Namaste. I will be using both the languages, Hindi and English. So, yes, you start with seeing with two eyes. Fusing is a word used here, but I think it is about transition, as it may or may not be able to fuse the things, the contemporary and the traditional approaches. So, home. So, the fusion starts, or the co-design starts at home, and this is our home in Azra. So Aniket and my journey started when we met at Anandwan. There is a place in near Chandrapur where Dr. Baba Amte had worked for a leprosy patient, and it is very well known around India. So our journey started there. We both had similar dream to come to rural area and work there, but we had we also had another different approaches towards it, that we wanted to go a bit towards the traditional knowledge and then able to sync with our lifestyle. So the co-design of health we wanted to plan from the home, and this is our home. It is mud home, and it is built by Aniket and his friends, and we still have to do the putai, that we still use the cow dung for plastering, and by God's grace we are still able to do it. It's a challenge, but yes, health co-design starts here. And the way we say that lifestyle challenges are there, so they are, the design part of it starts at multiple levels, and kitchen is the basic of what we eat and how we live. So this integrates to the kitchen. Next. Before coming to the next slide, I will be touching about modernity, and as we are yesterday, since yesterday we are talking about modern medicine, so it is a byproduct of the modernity. So speed of life, that is fast food, fast life, fast emergence and spread of the disease, and then fast death. So everything is in the speed. So, and it is not that modernity is limited to cities, but also in the rural areas it has touched. So basic principle, that is best and latest, is what modernity follows, and it is ever changing. But the most distinguished feature or the difference is about sync with nature, whether modernity is going towards that or not. And it looks that it is not in sync with nature, That is a big difference. So the impact on the healthcare. So as ma'am was saying, transnational double-blinded study models, according to allopathy, if they are done, then only they are accepted. And it is a doctor-based system, modern medicine, that if you are ill, you are supposed to go to a doctor, ask for the prescription, and then that is all. And again, it is more of the pharma and uh, you know the attached links with the technology. And having said this, that yes, modernity is 1 2 3 4, but we have to accept that we live in the modern world, we cannot leave it. So there will be consequences of this lifestyle on our health. At certain extent it is inevitable, we cannot say no, it has no effect. And as we can see, we all have gadgets around us. And so it is that we have to accept this reality. So root cause of disease in modern era that we are seeing, and as ma'am said, that we, for the diabetes, they conclude with the lifestyle, and this has a basic principle that they can change. So at present, what we are facing, Indians, or overall the globe, what we are facing, that irrational and injudicious use of drugs and pill dependency. So I will be talking about what I see at rural level in Azra, Kolhapur, where I am working. So the modern medicine magic pill came. They thought modern medicine is a magic pill, and yeah, it will, all our problems will disappear. And this has been taken up by many people, including the quacks. So they took these magic pills to the rural level, and for example, arthritis is the most common problem we can see in the rural area. So for arthritis, they will be giving analgesics and steroids, and the vicious circle will start from here. For example, when grandfather has a problem of arthritis, the magic pill will enter. I mean, it has entered around 20 30 years back, when the quacks were they knew about the magic pill and they started using it. So it started some 20 30 years back. And then one day, one injection and one tablet, they felt, oh wow, this is amazing, I never felt this great after using so many medicines. So he will think about it is magical. And then slowly that quack will keep on coming. He will keep on giving. After, like, for 10 days regime, they will give 10 days, you give this, you take this pill, and after 10 days again I will come back. So the injection and the 10 days tablet, injection and the 10 days tablet, this continues. And then the side effects of the steroids will start appearing. For example, a modern physician is using, he knows where to stop, or he will, if they are loyal enough, they will tell, no, steroids are causing the side effects, let's stop at this point. And they will think, okay, are there any other options? Again, resource setting and low cost will be a question there, but still that is there. So this tata is now dependent on those magic pills. He comes to me, I want to be a change maker in the system. Okay, I will bring back the traditional medicine. So I'm entering the system, and he is taking it since 20 years. I know there is severe osteoporosis as a side effect of it. His renal, liver, and cardiac parameters will be definitely deranged with the use of these many years. And now I want to prove that traditional medicine will bring a vast change. So there appears a question that he is dependent on it. Now to get rid of that system and to start something new is challenging for me also. Sir has a magic of it because he has a different aura that people like this dependent, steroid dependent, come to him. And yes, we can say it's the aura that works. And the second thing, he sees someone like him treating. So he know I am also an old man, he's an also old man. So there is a sync between them, and what he prescribes makes effect, gives result. But for a person like me, it is definitely challenging. And so now we see to the current generation, what can be the changes that can be done at this point of time. Maybe to the grandfather, I may or may not be able to, give his previous life, or the, can will be able to change the disease. But I think people like me will will be having a role to initiate with. So from the modernity, so this way we both started our journey in Azra, and then I was not sure about what way I have to go. The only thing, rural practice I had to do, and then this traditional medicine came up next. So then came the COVID era, and that was a game changer for me, because till then I had more, like ma'am said, no, I had more for the mm, allopathic medicine. I felt it is better. I mean, I was more comfortable being a postgraduate of CMC Vellore. I felt that is more comfortable. But during this era, we saw that there are many lacunae that our system has, limitations of it. We understood, and yesterday we were talking about design of the hospital, and so let's go to the ICU. So this was actually an hostel given to the one hostel given to us, 200 bedded, and we changed it to a COVID hospital. So this is our ICU. You can see the windows are there. There is no AC, and this Tata, he's around 65 years old. He sells newspaper for his livelihood, and he became critically ill. Like yesterday, we saw many case studies. So his saturation was around 40 when he came to us. The primary objective of this unit actually was to treat the mild COVID patients, but we progressed to moderate, and then severe also we had to deal. You can see one machine there. So we never saw this machine. It's a kind of BiPAP machine that works. So we had no expertise in using. So we learned during COVID era how to use that. He is given one kashaya. So that was a small introduction which I felt like for my level I will be able to integrate in a way. So my observations during the first wave, that yes, I in a way I was not very powerful being an administrator to combine both the pathies, but I understood the limitation in the first wave, and then second wave we started applying this. And I have not done any RCT for this, but my observation was that what difference was there in the first wave and the second wave is that yes, we were more familiar with the drugs by the time we reached the second wave, but I was able to confidently integrate or allow the vaidyas to, if someone is bringing their medicine, I will allow, okay, you can use it. That is what I have done. But what significant difference is that I saw the tapering of the oxygen dose, the requirement of the oxygen, and the tapering of the steroid doses we were able to do better during the second wave than the first, because we had support of something which will take care of the immunity, as ma'am said yesterday, Girija ma'am. So that type of jwara was taken care by the Ayurvedic medicine, and then we also had homeopathy, by the way, as in support, like um, single, yeah, arsenic album was daily distributed to the patient. I then again, what ma'am said is the question: Ayurveda is going inside, allopathy is inside, homeopathy is going inside. My question during the COVID era was, what is happening inside the body with these many systems going in, and what is the combination effect of it? And again, uh, what is if something going wrong, crossing. So that was there. But the COVID experience made me think that okay, there is an alternative, there is an way. It may be mainstream or it may be alternate. Now, so after the COVID, next slide. I met Purnima ji. Between us is our Guruji. I will be talking about Runanabandha at the end of the session, but yes, so this was the bridge, we can say. We met, and then again this thinking about something else is still there which we can think of, and rather than just singular allopathy. Next. So Aniket introduced me to Vaidya sir, and their journey began. For first 1 year, he felt this mad girl is standing beside me. What is she doing here, and why is she? I mean, I can have many other intentions. She's passed out from passed out of CMC. She can do her practice. Why is she here? So for 1 year, it was in his head ki what is her exact intention. But yes, I passed his test, and then after 1 year we became even more familiar with each other, and now we go to Yadgud. So as ma'am was saying, it is a Guru Shishya Parampara with which I am learning from him. But more, I would say that patrata. So he was testing the patrata, and if he felt, or when he felt he okay, it is the time or it is the correct person, I can offer. So then this relationship started, and we did not have any particular ceremony of Guru Shishya, making of that, but it was an eventually a process, gradual process with which it continued. Next. Next. I have different way. So I go to Yadgud. It is around 60-kilometer distance from where I practice my allopathy, and I'm learning to understand. I'm trying to understand Ayurveda perspective. And again, the what I said, what these two drugs or what these two pathies are doing integratively inside the body. So as I said, modern medicine, we are not just we will not be able to get rid of in one day. We have a lot of chronic renal failure patients, for example, at Yadgud, who are taking medicines. We know chronic renal failure, that is kidney failure patients, they go for, because erythropoietin is a hormone and which is responsible for a production of blood, we can say. Hemoglobin is decided not just on what we eat, but the hormone which is it has a central role. So they do not have this hormone, renal patients, and so these patients, they have repeated severe anemia. So what I was observing, that sir was ready that okay, if a patient, we are giving them medicine for the chronic renal failure, their creatinine or their other parameters, their urine output, it is improving, but for example we are lacking in correcting their anemia, it is okay, you can go for blood transfusion. So in a way, that patient is being taken care. Okay, if you need emergency, I am there. For the chronic treatment, I know for renal failure, we do not have much to offer to the patient in terms of allopathy. So okay, you are being taken care of this way. But if an allopath say no, you have all the minerals and heavy metals that I cannot allow you to take, so the patient is in a dilemma, or whatever dhairya he has, he loses it. And if the confidence goes, then that therapy doesn't work. Even if the therapy has an intense value, but still, oh, if my emergency physician doesn't see me, then what happened? So this way, I thought, is a role of mine, where I can be not just about mixing medicines. I will give some medicine and you give some medicines. It is that whenever you will need emergency care, I am there. You can continue search medicine. So this way we work at the Yadgud. Photo can I Yadgud sa? So you can see sir is sitting here under a tree. That is what his usual clinic. After COVID, till COVID he was inside, and after COVID he came outside. And Janapada Dhonsa, he was telling yesterday, so when pandemic comes, you have to see from a little distance, but it doesn't mean that you only show pulse rate and SpO2 with a pulse oximeter. So he again went back and studied Janapad Dhonsa from different texts, and then he was thinking about Darshan Chikitsa. Darshan Chikitsa, like from yesterday we were seeing many people, they are coming and asking, and sir from a distance of 5 feet telling, okay, he may be having this thing, this thing, this thing, this thing. So that is darshan chikitsa, which I learned and which I am integrating in the allopathic science. For example, there is a example, one more pandemic. We don't expect it to happen. For example, there is a pandemic, and an allopath is not able to see the patient or not able to touch the patient, but he can see from a distance, or a homeopath wants to see from a distance. So what are the parameters by which you can see what is happening in which organ, or what is happening overall in the body? So this is a darshan chikitsa. Patient sits here and he sees from this distance, and then he will be charting in his paper what are his observations. He will prepare the medicine. I mean, he will prescribe the medicine. Then he will go through the reports of the patient, and that is more interesting. That then he shows, like, he is very fan of this, that he will write cardiac murmur, whatever he feels is inside, and then he will call the relative and he says, see, this is matching with this, this is matching with this. So a patient also, that trust comes there. Oh, he already knows about my disease, because generally when we go to the doctor, we bring our file of old, prescriptions and investigations, and we show it to them, and then, okay, you have this disease, this disease, this disease. But when someone says, okay, you have 1 2 3 4, which I have noted, okay, let's go through the reports again and see if I need to anything add. But most of the times he doesn't need to add anything. He is done with his darshan chikitsa. That what he has expertise after COVID, and he's learning again. I mean, it is relearning and relearning. At the age of 75 76, he again made changes in his therapy. So this happens at Yadgud 2 days in a week. We are there, and we have 2 teams. The most of them around there are non-medicos. They are lawyers, they are engineers, but who are really, fond of traditional medicine, and they want to play certain role in his work. So from around the globe, I can say, and around all around our India, patients visit here. He is very clear. He says, I am not Dhanvantari. You come to me, for example, and I will prescribe you. There is a disease, so there is a medicine, but if you will get treated or cured or not is not in my hand. He is for that purpose. So he is that genuine to say it clearly. Otherwise, most of the people, they claim we treat HIV, we treat cancers, 1 2 3 4, but he will say there is a disease, there is a solution. If that will work out or not depends on multiple factors. So as I was telling about pandemic story, so during the first wave, we treated around 2018 patients. Similarly, during the second wave, and I told you the interpretation of it. And now coming back to Yadgud, so indigenous medicine. So they have multifaceted approach for maintaining and promoting health, which I was very keen to learn. Then kitchen, I was saying, in the kitchen being the prevention and the primary care, and secondary and tertiary care handled by vaidyas. So as I was saying in the beginning, fusing, I may not use, but I will say transition towards the modern approach to the traditional approach. And why the need of transition is there? Why can't we just jump in a fraction of time? Because in this fast time, we have seen patient losing their sabra. Sabra is patience with peace. So if they are diagnosed with certain disease 1 2 XYZ, they will be seeing certain approach which will give them, magical answer. But that doesn't exist. You will have to create that patience to undergo. Your body has that cancer, or that diabetes has not evolved over 1 day period. That has taken place over many years, and then it will appear on a day. That diagnosis will appear on day, so that sabra is missing. So because of the absence of sabra, we have to use emergency medicine. If the sabra is there and we are not in the Kali Yuga, then yeah, this will be the main pathy. But being in Kali Yuga and sabra being not there, so there we need to think of transition. And then there is Dravya Chikitsa and there is Adravya Chikitsa. So if the patient is not able to help himself with medication or something, and but the relatives can do the mudras, yes, that is Adravya Chikitsa. That is something which we are not giving anything to the patient, but still we are trying to help him to recover. Now I will come to the case study. So it is not a study, I will say it is an experience. So she's our pharmacist. She's 22 years old and she's a chronic pancreatitis patient for last 12 years. She's under treatment for her chronic pancreatitis at Yadgur. So what happened? Some 2 to 3 weeks back, she had an episode of fever, and then it was which was diagnosed as dengue fever. I was not inside. I was not in town. I was away. So she was being seen by a physician, and she was given oral antibiotics. And when I came back, because while going, I told her you keep a watch on your pancreas parameters as well, along with the fever parameters, which I had handed over to the physician also. That time everything was looking good, and I thought she will come. She will recover soon. When I came back and I saw she was from the dengue fever, she was with the dengue viral hepatitis. She landed up. So she was chronic pancreatitis now with the viral hepatitis. And when I reached same night she had an attack of acute pancreatitis. So it was a very fearful condition that some chronic ailments are there. Pancreas inflammation hits so bad. It is said to be the worst pain of the body pancreas can give you. So she was with that, and the family, they knew her condition. I mean, they knew her illness. For acute pancreatitis she has already needed so many admissions, but they knew, they had trust in sir, they had faith there. And so they asked me if you can integrate your whatever support I will be able to give and continue sir's medicine. I told them I have discussed with the physician. He is saying that she needs to be at the tertiary center because the liver and pancreas both are affected and she may even go for the complications. But they had the courage to say, no, we want to stay here. If you anytime feel that it is going really bad, then you refer us. So when we started, I talked about this to sir, and then he said, okay, is patient able to take anything orally? I said, I am of the opinion that I want to keep her NBM, that nil by mouth, because of the attacks she has inside. She has pancreas and hepatitis. Both will not be able to. I mean, both will cause her not to take anything inside. So when her nausea or vomiting sensation comes down, then we can give her something inside. So he said, okay, that is there. Okay, we will give something from the outside. So we will give something only for local application. And then I was thinking, by local application, how can that pancreatitis and hepatitis being taken care? How will that happen? I mean, I had this question, but I knew. Sir is saying, he's saying by experience. So I said, okay, let's go. So I kept her NBM, whatever oral fluids or alternative allopathic medicines that could be given, apart from the antibiotics, we gave her. Yeah, she was NBM. And the IV drip was, just what we can say, she had under, okay, I'm under good care. She had that feeling. But I knew I was taking care of all the parameters and I was reporting to sir. After application of whatever external application he gave us, she had relief within 6 hours of the pain. Then gradually over over a period of 2 to 3 days, she started eating. We gave her medicines, and I was very happy that with very low cost, this severe acute pancreatitis with hepatitis was taken care. Huh? And yeah, one more thing to add to it now, because we are talking about traditional medicine. This is a role of, they belong to Gondhari Samaj. So that tribe, uh, they are the performers. Earlier they used to be, now they are mostly in the recycling of the waste. So they had been to their Vaidya, and I think it is difficult for you to see, but some external one काय म्हणतात त्याला? Yesterday we were talking about kardoda, no? So they have put some medicines and they have tied as a band near her waist. So she has support of that, she has support of sir, and she had support of me. So from inside also there was feeling of well-being, because she felt supported by so many systems, though we all had different role. But if I tell this story to my allopath friends, they will they'll be very angry. But yes, first they will say, why did you take such severe case at your place at taluka level? We don't have ICU support. Why did you do that? First thing they will ask me. But somewhere we have to keep the faith, keep the tertiary center informed that I'm taking care of such and such patient. If that patient becomes critically ill, I will refer, and so on. So these are the challenges. But yes, these are the experiences which again gives us the confidence that yes, we can work together as a team. So she's a pharmacist. What to add? I think about bridging the gaps. So basic principles, as ma'am was saying, 5 minutes. As ma'am was saying, basic principles are different. So even if we perform RCTs or whatever, we will have to consider the basic principles. What I am trying to learn, that principles of both the system or the different system, we have to gaze through different angles, and learning by observation, learning by doing it, then understanding the healing power of the nature. And the nature is around. Sir gives an excellent example. For example, there are many patients who come with bronchial asthma attacks. Sir will ask, do you have Adursala काय म्हणतात? Vasaka around you or near your village? They will say yes. Then he say, you are going to be soon. You will be very soon, you will be well. Don't worry. So the nature has an answer inside around the vicinity, and therefore that is an indication that you are going to get treated soon. So then the collection of these medicines. So what sir has made a system. Yes, we were talking that how can we assure about the quality, because there is so much pollution. So when we tell the patients, you bring from your home, you bring vasaka, you have in your village there is more vasaka, you bring that vasaka. So when that person is bringing vasaka to sir, he will make sure that what are sir's principle he is aware of. So he will bring the vasaka from the very best place he can. He will pick up from those places, and the collection is done now by most of the patients. They will bring from their vicinity whatever medicinal plant they have. Over the phone while taking appointment, sir will be telling them, आपके घर के आजू बाजू में ये 1 2 3 4 मेडिसिन है, तो आपको जितना जमता है विदाउट डिस्टर्बिंग द ट्री प्लांट यू ब्रिंग इट वेल कमिंग, और उसके बाद में फिर वो प्रोसेसिंग करेंगे. तो इससे ये बनता है कि ये तो कम्युनिटी मॉडल भी हो गया, क्योंकि कम्युनिटी का इन्वॉल्वमेंट है मेडिसिन प्रिपरेशन में. बट एट द सेम टाइम सर इज टेकिंग केयर कि उनको प्यूरिफाई या फिर जो भी उनके ऊपर आगे का प्रोसेस करना है, ही इज़ डूइंग इट करेक्टली. सो ये है कि हम दवाई भी दे रहे हैं, पर वो दवाई किसी फार्मा इंडस्ट्री के हाथ में नहीं है. माने हम ऐसे वैद्य नहीं हैं कि हम सब प्रिस्क्रिप्शन बाहर से लिख के दे रहे हैं. ये ऐसे मेडिसिन है, मेजॉरिटी ऑफ देम विल बी टेकन केयर बाय सर, एंड देन फ्यू विल बी रिटर्न, फिर व्यू विल बी प्रिस्क्राइब फ्रॉम आउटसाइड. तो इससे बात ये बनी है कि सर की दवाई महीने भर की 1000 रुपीज़ के अंदर हो जाती है, और पेशेंट को बेनिफिट, वो जो आते हैं लोग उनको इमेंस बेनिफिट मिलता है. तो बोलते कि आप इतना कम क्यों ले रहे हैं? तो सर ने कहा कि आप दवाई ला के दे रहे हो, मैं प्रोसेसिंग कर रहा हूँ, और हमें ऐसा मॉडल सोचना है कि जो लो कॉस्ट इफेक्टिव केयर हो. दैट मॉडल हैज़ टू बी लो कॉस्ट एंड इफेक्टिवली वी विल बी एबल टू टेक केयर ऑफ द पेशेंट्स. सो दिस इज अबाउट सर. देन what role we play now. sir was saying that we should, or a Vaidya should have his own pharmacopoeia. So own medicine should be there. That is something which is your one way of वो कॉन्फिडेंस आपको आएगा कि हाँ दवाई भी मेरी है, उसकी इफिकेसी भी मुझे पता है. सो कलेक्शन एंड देन स्लोली टुवर्ड्स द प्रिपरेशन पार्ट ऑफ इट. तो ये जो पिक्चर दिखाया था इसमें हमने कलेक्शन किया है. ये सीजनल है दवाइयाँ, जो अभी हमने देखा था कि दिल्ली में ये हाँ सेमल जो है अभी हर तरफ सेमल दिखाई दे रहा है. तो इसका कलेक्शन, हाँ तो इसका कलेक्शन अभी हमारा वहाँ पे कंप्लीट हो चुका है. अभी इसको फ्लावरिंग स्टेज, इट इज़ नॉट इन द फ्लावरिंग स्टेज एट प्रेजेंट, वी आर डन विद द कलेक्शन. तो ये छोटी छोटी चीज़ें, द स्मॉल एफर्ट्स दे रियली मेक डिफरेंस. और जैसे है कि ये हम करते भी है तो हमें पता भी चलता है कि उसकी तासीर कैसी है उस पेड़ की, क्या निसर्ग चाहता है, वो कब आ रहा है कब जा रहा है, पिछले साल में कब आए थे ये फूल, लास्ट ईयर व्हेन डिड दिस फ्लावर blossom, and now what is happening this year. So many linkages between the nature and what is happening in it. तो एक नॉन सर्जिकल इंटरवेंशन के बारे में दिखाएंगे. वन मोर केस स्टडी. He is one diabetic patient who came with history of injury to his left arm, and he came with a stage of कि उसको बताया था, he was told that he has to undergo amputation from, because it was about to fall like situation. As you can see, it was a non-healing wound for around 1 month, and he was advised कि no, healing is not going to take place with the medicine and other intervention, you have to go for the surgery, that is amputation. We started I think 4 months back, that is our July, and now in the November you can see the fusion. So this has happened with more, I will say, the sabr of patient. The patient became patient in a way that he had kept the patience. Okay, if I'm going through for some non-surgical intervention, I will keep patience. And so you can see now we are able to get back the hand. The next thing which he told कि okay, now I want more of the functioning hand, not just the हाथ के लिए हाथ नहीं है, उसमें फंक्शन भी है. तो सर ने कहा कि हम पहले इसको बचाएंगे, उसके बाद हम इसका फंक्शन भी शुरू कर देंगे. तो दिस स्टेप वाइज अप्रोच, he is already happy that he is with his limb. बट ये जो इंटरवेंशन है इसने ये भी बताया है कि हाँ अलग अलग अप्रोचेस से चीज़ें हो सकती है. अभी I come to the last slide. So yes, we were talking about co-design. मुझे यहाँ पे एक चीज़ जो बतानी है कि ये सब जो जुड़ के आया है, the integration of different people at one platform. So I'm very thankful to Vijay sir that he has made this effort of co-design and integrating different people from different branches. ये बात है जब ये सर का आया था इनविटेशन कि वी आर प्लानिंग सच एंड सच इवेंट, एंड सब लोग आए साथ में, ऐसा हम सोच रहे हैं. तो मुझे याद आया कि ये सब लिंक, हाउ डिड दिस स्टार्ट. I belong to Maharashtra. I have no link at IIT Delhi. He belongs to Yadgud. He has no link to IIT Delhi. And then through Purnima ji and then Vijay ji and Mittal Saab, so we all come together. तो ये मुझे लगा कि ऋणानुबंध इसलिए है कि जो शर्मा गुरु जी है जिनके बारे में कल बात हो रही थी, शर्मा गुरु जी की वजह से मैंने पूर्णिमा जी को जाना, पूर्णिमा जी की वजह से हमने विजय सर को जाना, विजय सर की वजह से मैं और आप सब लोगों को मिली हूँ. तो ये हर इसमें ब्रिज ना एक गुरु का है. सो देयर इज़ अ ब्रिजिंग गुरु बिटवीन ऑल ऑफ अस. आपके गुरु जी का नाम एस शर्मा. तो यहाँ पे बहुत सारे गुरुओं का जो है वो बहुत बड़ा रोल रहा है. हम ऐसा सोचते हैं कि जब तक गुरु जिंदा है, till the point guru is alive, he will be able to bless you. But I felt this symposium is an example that guru will take care of you even after his death. So this is what I have experienced. क्योंकि these many क्या बोलते हैं, इतना संजोग नहीं बन सकता. नहीं, इसमें कुछ ना कुछ तो blessings have important role in bringing different type of people together, और वो भी like minded एक ही चीज़ पे काम करने वाले. So I'm very thankful. एक और चीज़ ऐड करना चाहूँगी कि मैं सर के साथ बहुत जगह पे जाती हूँ, पर जिस प्रकार की हॉस्पिटैलिटी यहाँ पे दिखाएगी वो मैं शब्दों में नहीं बयां कर पाऊंगी. तो एक होता है ना कि हम औपचारिकता से वेरी फॉर्मलनेस वी इनवाइट समवन एंड बट यू कैन सी द लव, दैट मेक्स ह्यूज डिफरेंस. आप जिनसे भी बात कर रहे हैं उनमें आपको वो प्रेम दिखाई देता है, और वो रिस्पेक्ट जो है, आदर भी जो है वो भी दिखाई देता है. तो लोग आए, साथ में बैठे, कुछ भरपूर घमासान चर्चा की, उसका कुछ इंटरप्रिटेशन किया, पर हाँ ये अलग बात हुई कि हम साथ आए और हम किसी बॉन्ड की वजह से एक दूसरे से जुड़ गए. अब ये होगा कि हम अपनी अपनी जगह पे चले जाएंगे, वी विल बी बैक टू आवर प्लेसेस एंड विल बी डूइंग आवर वर्क, बट येस दिस लव इज एन अटैचमेंट और इट इज एन बाइंडर कि वो सबको बांधे रखेगा. फिर डिफरेंट पॉइंट ऑफ टाइम पे शायद हम एक दूसरे को कांटेक्ट करें, वी मे कांटेक्ट ईच अदर एट डिफरेंट पॉइंट ऑफ टाइम इन आवर लाइव्स, बट येस that is the difference which I felt at IIT Delhi, and I'm very thankful for this event and for inviting us here. On behalf of sir also I would like to show my gratitude, and आप लोग सब लोगों का यादगुड़ में तहे दिल से मैं स्वागत करती हूँ. जैसे हम 2-3 दिनों से देख रहे थे ना कि बहुत सारे लोग आके पूछ रहे मुझे क्या है, मुझे क्या आप इसका इलाज आपके पास है क्या, डू यू हैव द ट्रीटमेंट फॉर व्हाट डिसीज आई एम सफरिंग फ्रॉम. सो ये है ना कि इसका इलाज है क्या, उसका इलाज है क्या, उसके परे हमें जाना है. वी हैव टू गो बियॉन्ड द डिसीजेस एंड सी कि सर के पास ही इज ओशन ऑफ नॉलेज. what how many drops one is able to collect, that is our responsibility. And he will not say ki your allopath don't come to me, your homeopath don't come to me. He will say your allopath come to me, your homeopath you come to me, we will see what we can do together. So I am very thankful ki aisa event organize hua, and I am very thankful to our Australian guest, and actually they are the hosts, sorry. So and they are patiently listening to us. In between the Hindi is there, and a lot of Ayurveda is going on, homeopathy people are there and they are वो हमें सहन कर रहे हैं. पर हाँ, this combination can take somewhere at a very good point it may turn out. So I am very thankful once again. मैं रुक जाती हूँ.